The U.S. Food and Drug Administration is ordering Pfizer and Moderna to expand warning labels on their COVID-19 vaccines. The new warning highlights a rare risk of heart inflammation, myocarditis, and pericarditis, mainly in males aged 16 to 25. The FDA cites new safety data, and a study showed that the highest incidence in that age group at 38 cases per million doses. Despite the findings, officials stress that these side effects remain rare and typically mild. The Centers for Disease Control and Prevention, or CDC, also notes most cases resolve quickly and the benefits of vaccination still outweigh the risks. And to talk about that, we have former chairperson of the country's vaccine expert panel during the COVID-19 pandemic and currently member of the Philippine FDA Scientific Advisory Committee. We have Dr. Nina Gloriani joining us on Morning Matters.
Yes, good morning, Rachel, and everybody.
Okay, Doctor, what do you make of this news that they are requiring, the U.S. FDA is requiring more warning labels for Pfizer and Moderna? How do we take this, and is there reason to worry?
Okay, we have already received, reports about myocarditis after COVID vaccination, especially after the mRNA vaccines, no? And as you have said, this is rare, but there have been recent data that showed real data, scientific data that proved that myocarditis after vaccination were really present. And this was the October 2024 publication from a safety surveillance report that spanned multi-center studies that involved about more than 300 people who developed myocarditis after COVID vaccination. So they were followed up, much of their cardiac function were tested. And so this came about, this recent expansion came about because of this more recent data. So what does that mean for us? We all know that vaccines have side effects. And at least for myocarditis, following mRNA vaccinations, this is rather rare. And we're still looking at benefits versus risk. There should be more benefit than risk. So we just need to be careful about people who get the vaccine. So if they have had maybe history of cardiac dysfunction before, and especially the young, but it does not mean that only the young, the 16 to 25 years old, get this. It's rather rare, 8 million. Now, for this age group, it's about 38 cases of myocarditis. For this age group only, 16 to 25, about 38 cases of myocarditis following 1 million of vaccination. But for the other age groups, less than 65 years old, 8 yung cases. So it's still low, no? But still, we have to be careful. What do I say? If people, we have no problem in the Philippines. We don't have COVID vaccination anymore. None of these manufacturers applied for CPR, even for the updated versions. So it's maybe for the others who actually take the vaccines in other countries where these vaccines are available. That should be asking their doctors if they can go through the vaccine.
Well, Doc, it's been 3 years since we opened up from the lockdowns of the pandemic. But for those who took Pfizer and Moderna, myself included, are we out of the woods?
Oh, yes. There's no problem with you guys. We have these high-risk groups. So if you have had this, you did not develop, the vaccine-associated myocarditis would develop usually within a week after the vaccination and usually after the first and second doses. Less for the booster and the third doses, other doses. So you're out of the woods. Don't worry.
Okay.
So,
Doc,
and there are risk groups talaga.
Paliwanag lang po natin, ano po yung myocarditis at pericarditis?
Okay. Myocarditis refers to inflammation of the muscles of the heart. Yung pericarditis may balot. It's the lining around the heart. So when that is also inflamed, we call it pericarditis. So some of these vaccine-associated conditions na myocarditis, yun lang muscles. Yung iba, pati yung lining. So myopericarditis. So pwedeng myocarditis lang or pericarditis or both. So that's what happens.
Pero medyo bata po yung tinesting po nila, no? Males age 16 to 25. Isn't that a bit worrisome?
Well, these are the data that emerge. So when you have so many vaccinated and they saw yung myocarditis, linat nila yan against all ages. And most of the cases of myocarditis were in this age group. Actually, a little younger pa nga yung iba, 12 to about 30. So pero yung pinaka-peak nandun sa 15 to 25, 16 to 20.
Okay, so what is the advice now, given all of this new knowledge? For those, if ever COVID, we do get reports here and there that COVID cases are rising again. What is the advice now from our doctors?
Well, COVID-19 is now considered endemic. So we have it every day. We can get it, but so far, as we know, Omicron related to the variants of Omicron, and they're relatively mild. Of course, for some who have comorbidities, we have to be more careful. We don't have the newer versions of the vaccine, yung variant form ng vaccines here in the Philippines, but we can take precautions as usual, no? So if we know na dumadami naman, or if we are at high risk, like kami, no? You take precautions, yung public health precautions, wearing masks, pag nasa labas kayo in crowded areas, public hygiene, sanitation, and all of this. So yun lang, we don't have the vaccines anymore, and we can go by the basic public health standards. Yun lang.
So wag na po magpa-bakuna?
Wala naman tayong vaccine dito sa Philippines, but
Wala
if they
na.
have the means to go abroad, I would advise na they talk with their doctors kung yung nando sila sa risk group. Kasi even the elderly, high risk sila di ba? And they're advised to take the boosters abroad, not here, no? Wala sa atin.
Pag sinabi niyo po wala po tayong bakuna, tinigil na po yung supply, ibig sabihin. So doctors
wala
are
ng
not yet.
CPR, yung Certificate of Product Registration, walang
okay.
nag-apply na suppliers. So they're not available anymore, even in the private sector.
So no COVID vaccines are available?
No, wala na sa atin.
Okay. All right, that's good to know. Thank you very much for that clarification and telling us that we who have taken those vaccines are out of the woods. That was Dr. Nina Gloriani, former chairperson of the Vaccine Expert Panel.